In the pursuit of a confident smile and optimal oral health, dental implants have emerged as a groundbreaking option. Here in Mangalore, our dedicated dental experts are committed to providing world-class implant services. Let's hear more from Dr. Umesh, a member of the International Congress of Oral Implantologists.
Once a patient gets in touch with us regarding wanting an implant especially, so what we do is we ask for a radiograph, a scan, CBCT, a 3D scan or a orthopantomogram, that is a 2D X-ray. Now once we get that data and once we have their facial photographs, then we schedule a virtual consultation where we are able to get in touch with them and speak to them regarding what we have planned for them. And once they come here, that is when the work starts, and we would be keeping one set of whatever is required for the initial procedures ready by then. So we initiate the early process and then we immediately send them, and the work is sent across to the lab and it is expedited as fast as possible. And I guess the turnaround time should be about 15 to 20 days from start to finish for a full mouth rehabilitation with crowns and bridges and veneers. And the patient comes to us for an implant procedure, depending on the number of implants. Now, if I'm going to place one tooth, one implant maybe, or two implants, you can roughly take the turnaround time for one implant is about 15 minutes to half an hour. That is just for the placement. Now, to make sure that there is no additional cuts or injections that are required, what we do is we already put a secondary component which is attached to the implant where the gum heals around it. So at 4 weeks time, when the patient is coming back, there is absolutely no requirement for an injection, a repeat injection again. And we just remove that secondary component, we do the scan and we send it across to the lab. After that, for the lab to send across, the work to take about 5 days to 7 days. There can be tissue changes around the implant. So if I am doing a scan on the day I place an implant, what will happen is that there is going to be bleeding. Scanner usually does not pick up the bleeding area and there can be some amount of distortion which is there. So that is why we do this procedure only at the 4th week mark, where we know that there is certain amount of gums which have healed and contoured itself very well, and then after that we do the procedure so that we know that the gums are very stable at that point in time. The next time they want to visit, and they can just drop by, have a quick checkup, and we will keep everything ready for them if they are intimating us to us well in advance that they are going to visit us, and we will make sure that all the arrangements are taken care of. Virtual follow-ups are mandatory when we are doing implants and any other procedures over the phone, and our back office staff will handle that. For implant patients, we do a follow-up every 3 months the first year, followed by a 6-month follow-up every subsequent year.
Get a great smile with Dentavacation. Visit a hand-picked dental clinic today.